Before you start taking Xarelto, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor. If you are taking this drug to prevent strokes and blood clots due to an irregular heartbeat, the dose is usually taken once a day with the evening meal. If you are taking this medication to prevent blood clots due to other conditions, such as after surgery or during a hospital stay, the dose is usually taken once a day. For adults taking Xarelto to treat blood clots, the dose is usually taken twice a day for the first 3 weeks, and then once a day. For children taking Xarelto to treat blood clots, the dose is usually taken once a day. If you are taking this medication to lower the risk of blood clots from forming again, the dose is usually taken once a day. It's important to follow your doctor's directions and not change your dose without consulting them. The 10 mg tablet may be taken with or without food, while the 15 mg and 20 mg tablet should be taken with food. If you have any questions about how to take Xarelto, ask your doctor or pharmacist. If you are unable to swallow whole tablets, you may crush the tablet and mix it with applesauce, but make sure to take the entire mixture right away. If you are giving this medication through a tube into the stomach, ask your healthcare professional for detailed instructions on how to properly mix and give it. The dosage and length of treatment is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Use this medication regularly to get the most benefit from it, and try to take it at the same times each day. If you experience easy bruising or minor bleeding, such as nosebleeds or bleeding from cuts, make sure to inform your doctor or pharmacist. This medication has been prescribed to you because the benefit outweighs the risk of side effects for you. However, it's important to be aware that this medication can cause serious bleeding if it affects your blood clotting proteins too much. Contact your doctor immediately if you experience any signs of serious bleeding, such as frequent or unending nosebleeds, unusual tiredness, or prolonged bleeding from cuts or gums. Get medical help right away if you experience symptoms of very serious bleeding, such as vision changes, confusion, or weakness on one side of the body. Additionally, seek immediate medical attention if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. Remember to contact your doctor for any other effects not listed here. If you are in the U.S., you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before starting rivaroxaban, be sure to inform your doctor or pharmacist about any allergies you have or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have a history of cancer, liver disease, kidney disease, bleeding problems, stroke, artificial heart valves, recent major injury or surgery, blood disorders, frequent falls or injuries, eye problems, clotting disorders, or hereditary enzyme problems. If you are planning to have surgery or any medical/dental procedures, it's important to inform your healthcare provider about your medication and all the products you use. Your doctor or dentist may advise you to stop taking rivaroxaban before your surgery, so be sure to ask for specific instructions. It's important to limit alcoholic beverages while taking this medication, as daily alcohol use can increase the risk of stomach bleeding. Be sure to ask your doctor or pharmacist about how much alcohol is safe to consume while taking this medication. Rivaroxaban can increase the risk of heavy bleeding, so it's important to use caution with sharp objects and to avoid activities that may result in injury. It's recommended to use an electric razor when shaving and a soft toothbrush when brushing your teeth. If you experience a fall or injury, especially if you hit your head, it's important to contact your doctor right away. Older adults may be more sensitive to the side effects of this medication, particularly the risk of bleeding. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It's also important to consult your doctor before breastfeeding while taking this medication. If you have any questions or concerns, be sure to consult your pharmacist or physician. It's important to be aware of potential drug interactions with Xarelto DVT-PE treatment 30-day starter 15 mg, 42-20 mg, 9, tablet pack antithrombin agents. Make sure to inform your doctor and pharmacist about all the products you use, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include mifepristone, other drugs that can cause bleeding/bruising, certain antidepressants, and other medications that can affect the removal of rivaroxaban from your body. Aspirin can increase the risk of bleeding when used with this medication. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Ask your doctor or pharmacist for more details. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include bloody or black stools, pink or dark urine, and unusual or prolonged bleeding. If you experience any of these symptoms, seek medical help immediately. It's important not to share this medication with anyone else. Your doctor may also want to monitor your blood levels while you're taking Xarelto, so make sure to keep all your scheduled medical appointments. And if you have any questions about these tests, be sure to ask your doctor for more information. If you are taking Xarelto once a day and you happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. If you are taking Xarelto twice a day and miss a dose, take it as soon as you remember. If you missed the morning dose and it's close to the time for the evening dose, you can take both doses together. Then take your next dose at the regular time. The medication should be stored at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. If you have to crush the tablet, use or discard the mixture within 4 hours. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed. When the medication is expired or no longer needed, dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.